Is foot pain or numbness and burning in your feet starting to affect how much you walk, move, or trust your balance? If so, then this video is for you. Hello, my name is Dr. Beth Templin, and I am the CEO and founder of HouseFit. Today, we're going to talk about foot pain, and not just the pain itself, but how it quietly impacts your mobility, your confidence, and ultimately, your independence. Because for far too long, people have been told that foot pain is normal. Maybe just wear better shoes or slow down a little bit. But as a specialist in geriatric physical therapy, I can tell you that this mindset is exactly what leads to people losing their function faster than they should. Foot pain is incredibly common, and it can be incredibly limiting. The most common conditions we see include plantar fasciitis, stress fractures, ankle sprains that never fully heal, neuromas, and of course, neuropathy. And here's what makes foot issues so serious. When your feet hurt or feel numb, burning, or unstable, it can affect everything. Walking becomes uncomfortable. Balance becomes uncertain. Exercise becomes less frequent, and confidence starts to drop. And what happens next? People move less. And when movement decreases, strength, balance, and independence also begin to decline. Many people, especially older adults, are told that they just have to live with it, so they adapt. They avoid walking longer distances. They start to skip activities they used to enjoy. They begin using a walker or a cane, and they become more cautious, sometimes even fearful of falling. But here's the truth. Avoidance accelerates decline. Foot pain isn't just something to manage, it's something that we can treat at the source. At HouseFit, regenerative therapy has truly become a game changer for foot and nerve-related conditions. We use EMTT, which stands for Extracorporeal Magnetotransduction Therapy, and Shockwave Therapy. These treatments are non-invasive, fast, and designed to stimulate your body's natural healing process. They work by improving circulation, reducing inflammation, stimulating tissue and nerve repair, and most importantly, helping you move with confidence again. Here's how it works for some of the most common conditions we treat. For plantar fasciitis, Shockwave helps to break up chronic scar tissue, while EMTT increases blood flow to accelerate tissue healing. For stress fractures, we use EMTT and focus shockwave to support bone healing and remodeling while guiding a safe return to activity. For chronic ankle sprains, which we know some of them never fully heal, we use regenerative therapy to help restore ligament strength and stability so we can avoid them in the future. For neuromas, those trapped nerves, we can calm the irritated nerves, reducing sharp burning and tingling pain. And for neuropathy, we improve circulation and support the nerve health, often reducing that numbness, burning, and that walking on cotton sensation that increases your risk of falls. And here's something many people don't realize. Foot pain and neuropathies are a major contributor to falls. We know that 1 out of 4 adults over the age of 65 experiences a fall each year. And one of the biggest predictors is loss of sensation and confidence in the feet. So this isn't just about comfort, it's about safety and independence. Let me tell you about one of our clients, Libby. She had been dealing with plantar fasciitis for over a year, and she had tried everything including 2 cortisone injections. And still, every morning when she got out of bed, her pain was an 8 out of 10. Those first few steps were brutal, and it really limited her ability to walk, exercise, and enjoy her daily life. But after going through regenerative therapy, something changed. She quickly became pain-free, and when we followed up with her 2 years later, she was still doing great. That's the kind of lasting results that we're aiming for. So, foot pain, numbness, and nerve symptoms don't just affect your feet. They really can affect how you move throughout your life. But you don't have to accept it, and you do not have to slow down. And you don't have to wait until it just keeps getting worse. Because the goal isn't just to reduce the pain, it's going to be to restore the confidence, stability, and freedom of movement. Thank you so much for watching this video. If foot pain, numbness, or instability are limiting your activity, call us here at HouseFit to schedule a free consultation to see if regenerative therapy is right for you. Make sure to follow us for more expert guidance on staying strong, steady, and independent as you age. And please send this to somebody struggling with foot pain or neuropathy. It could change how they approach their health.